Our last presentation this morning is a proclamation to designate May 2016 as Lyme Disease Awareness Month in Fairfax County. We have with us this morning Monty Schall, Executive Director for the National Capital Lyme Disease Association. And if Monty could come on down, and Supervisor Harity, you have a proclamation to move.
Yes, Madam Chairman. Whereas Lyme disease, the most common tick-borne illness in the United States, is transmitted to humans through the bite of infected black-legged ticks, and whereas 202 new cases of Lyme disease were reported in Fairfax County in 2015, however, this number does not reflect the total burden of the illness because many go unreported or undiagnosed, and whereas untreated Lyme disease can lead to serious illness and early diagnosis treatment help avoid the cost and complications of infection and later stage illnesses. And whereas knowing the symptoms of Lyme disease, which include fever, headache, fatigue, and in some people a characteristic bullseye rash, will help people seek early diagnosis and treatment from their healthcare provider. And whereas preventing tick bites is the best way to prevent Lyme disease, which is why the Fairfax County Health Department recommends avoiding places where ticks are found, using repellent containing DEET, wearing long, loose-fitting, light-colored clothing, and conducting regular tick checks and promptly removing any attached ticks. Now, therefore, be it resolved that the Fairfax County Board of Supervisors, on behalf of all residents of Fairfax County, does hereby proclaim May 2016 as Lyme Disease Awareness Month in Fairfax County and urges all residents to learn more about Lyme disease by visiting www.fairfaxcounty.gov. Fight the bite. So moved.
Moved by Supervisor Harity and seconded jointly by Supervisor Linda Smith and Supervisor Faust. Is there discussion on the motion? Supervisor Harity.
Yes, Madam Chairman, briefly, I'm happy to see us do this again. Lyme disease is a horrible disease. More and more people I meet have been affected or had families and friends affected by Lyme disease. It is the sixth fastest growing disease in the United States. And education and prevention are the key, which is why we do these proclamations. Early detection is especially important with Lyme disease because you can cure it with a simple dose of antibiotics, but once it gets into your muscles, it is ever harder to treat and causes all kinds of very serious problems. The rate of Lyme disease is growing in Virginia, and especially in Fairfax and Loudoun County, so raising awareness is critical. In 2010, you'll remember we had Temple Douglas, the TJ graduate, that had come up with a new test and worked with GMU. It's a great local story. I want to report kind of that work's begun on a commercially available version of that test that can be performed at home, which addresses one of the big problems with Lyme disease is the unreliability of early blood tests. Temple's completed her graduate work at Princeton's now a PhD candidate at Virginia Tech, but this test could kind of change some of the way that we work to battle Lyme disease by making a reliable test available to people at home.
Thank you, Supervisor Harity. Others who wish...
And before I
yes.
want to thank Monty for all the work that NatCap Lyme does to raise awareness and help people that have this disease.
Thank you, Supervisor Harity, and let me add my thanks, and I appreciate Supervisor Harity for bringing this issue to the board once again. It's important that we make sure that we're aware and prepared, and that we're putting proper resources into making sure that we're keeping people safe from what I know is an extraordinarily debilitating, or can be debilitating illness. It can be very mild, but for others it can be crippling, and it's important that we're aware and take the kind of precautions that we need to in order to keep ourselves safe. With that, all those in favor of the motion to approve say aye. Aye. Opposed say nay. That motion carries. And Executive Director Monty Schall, is there something you'd like to share with us?
Thank you. Supervisor Bulova. Yes, before we start, since we're the last on the program this morning, I would like to introduce my colleagues just briefly. Maureen Crystal, Kathy Below, and Marjorie Vega. And we're all volunteer, and that's which makes this really special, because people, residents of this county, have given their time and their efforts to create an educational program about tick-borne diseases. The National Capital Lyme Disease Association is grateful to the Fairfax Board of Supervisors for its continuing commitment to raise awareness about Lyme and tick-borne diseases in Fairfax County by designating May Lyme Disease Awareness Month. Lyme disease is regarded as the fastest vector-borne infectious disease in the United States today. Last year, the CDC reported 329,000 cases of Lyme disease being reported. This year, the unofficial report, they haven't come out with it, but the CDC is going to report 442,000 cases. So this is a major jump, almost another 100,000 cases. Virginia has not been spared, and we know the importance of this disease here in Fairfax County and Loudoun County also. The CDC says there's nothing greater than you can do than public awareness about this disease in the form of prevention and early diagnosis and treatment. So for that reason, this proclamation is of great benefit to the citizens of Fairfax County. The measure extends official recognition of the problem, encourages Virginians to learn about these diseases, to treat tick-borne diseases seriously, take aggressive preventive measures, and seek early treatment. For that reason, on behalf of all the residents of Fairfax County that are dealing with a tick-borne disease, on behalf of the National Capital Lyme Disease Association, and all of its members, and its 14 chapters throughout Virginia, we would like to thank you all for doing this again this year, because we feel that education is your best defense against this disease. So thank you very much. And I would like to say one other thing. I've been here for a number of years now, and I miss an old friend that was here with me numerous times, Dr. Jorge Aries.
Yeah.
And Dr. Aries, as far as I'm concerned, has really done so much for this disease when he worked for the Fairfax County Health Department, because he created the best literature out there. Mm-hmm. It is used nationwide. And I always said to him, we honored him before he passed away, I said, as long as I'm asked back, I will always mention your name, because you have made such an impression on this community. So thank you all very much.
Thank you for doing that. We miss him too.
We really do.
We do.
And Carl Silverstein.
And Carl, yes. Okay, with that, I think we're ready for a photo. If you could come forward. If there's anyone else who happens to be here who would like to join us for this proclamation, Supervisor Harity and I will come down and